Hi, this is Dr. Simcha Shapiro for Expert Village. We're going to talk a little bit about some of the techniques in osteopathy now. I'm going to introduce with probably the most well-known technique in osteopathy, which is the HVLA, high velocity, low amplitude, otherwise known as thrust techniques, or in the common vernacular, they cracked my back. So this type of technique, as is implied by the name, involves a high velocity. It's a quick movement, low amplitude over a very short distance that is very focused in one particular area, and it's going to bring all the force right there in order to move what needs to be moved. It's what's called an articulation technique, which means it's used on joints in order to move restricted joints and free up the movement. Now, in osteopathy, we have a specific way of doing it because there are a lot of different areas of specialty which use this technique in one form or another. We do what's called long lever techniques, which is unique to osteopathy. Long lever, if you remember your physics, implies I'm going to apply force at one end, and at the other end of the lever, it's going to make a movement. So if you think about a wrench, the longer the wrench is, when you grab on the end of it, the less force you need to use in order to make a big effect at the other end. So we do the same thing. If I'm doing this type of treatment on somebody's back, I'll apply the force through their elbows, as you'll see, and it will come all the way through to their back, and I'll need to use very little force, specified very specifically, in order to get a really good effect to release things on the other side.